today, I have to say today we had one of the highest RSVPs for any topic that we've had so far with Virtual Mental Health Monday, which really indicates how important and how this touches all of us at one point in our life or another. Today we're talking with trauma and grief experts. We have clinical psychologist Dr. Rebecca Rampe and Dr. Bree Conklin, the director, she is a director of Doctor of Social Work. And they're going to discuss traumatic grief, dispel some myths around grief, and just talk about ways we can begin to address it in our own lives. And they will share their evidence-based approaches to healing both within and outside of traditional clinic settings. So with that, I am honored to turn it now over to Dr. Rebecca Rampe.
Hey everyone, thank you so much for joining us today, and I'm going to share my screen so we can get started with this. So we're going to start with Dr. Bree, if you want to jump into, because I know you want to talk a little bit about what brought you to this work. And Bree and I actually met. We both went through the Compassionate Bereavement Care certification at the Salah Care Farm out in Sedona, Arizona, which is the model we'll talk about today. And we both do the neurosequential model work under Bruce Perry as well. So we have some overlapping connection. And of course, she's up in Knoxville, so not that far away. And so a few things that brought me to this work, I've done a lot of developmental trauma work for many years. And then in 2019, and I've done a lot of grief work. And then in 2019, my father died of an overdose. He'd struggled with addiction all my life. And that really led me, the way people responded and really didn't know how to care for that part of me really led me to do this work. And then unfortunately, my dog of 15 years passed away in December of last year. And we do want to remind people that our pets and animals, it's beings, or, we can love, and really they have a place in our heart too. And that grief matters a lot as well when we're talking about this work. One thing I'll mention, I work in psychiatry and behavior neurobiology over in the School of Medicine. And there was an article about the clinic, the Developmental Trauma and Traumatic Grief Clinic that I opened here in August. And the article in the reporter, the tagline was, "You can escape childhood trauma and traumatic grief." And you absolutely cannot. And that's definitely not the way that we talk about it. It was just an unfortunate tagline that was chosen that didn't maybe match the article. And so really want to preface that we will not be giving you any escape routes or anything. It's that definitely feeling and being with it when we're talking about healing. And healing is a very active word for a reason, because it's not a healed kind of check and done approach with it too. So that's just a smidge about me. I'll let Dr. Bree go a little bit about your work.
Yeah, thank you. Thank you so much. And also, I would lean in the direction of saying that tagline is really quite the opposite of the way that you and I both practice. Because in fact, instead of escaping it, we really try to come from that approach and that framework of embracing and allowing grief to have a presence in life and continuing in our current life and continuing those bonds with the loved ones that we've lost. Because so often, both myself and the countless clients that I've worked with and humans in my personal life, folks want you to get past it, to get beyond it, to stop being so sad. I've literally heard that from, individuals where their children have been murdered, and a year later, their family members want them to not be sad. And there's always going to be a part of you that is sad, but it's how do we embrace that and continue the bond in a way that allows us to have that wholehearted presence with our the humans that we love so very much that are no longer with us, so physically. And so I am a licensed clinical social worker, very proudly. I have both my master's and my doctorate in social work. Being a social worker is who I am. It's in my bones. I've been a licensed clinical social worker for quite some time and have been in clinical practice also for quite some time. And within my clinical practice, there's always these pivots that happen. And so I started my work working primarily with children and adolescents that have experienced trauma, typically complex trauma, But I learned that I really loved working with the adults because if we are working with children, we're working with their parents too. And so I started pivoting and working really quite a lot with adults, and got a lot of training in various modalities and certified it in a lot of things that really just say all roads lead back to there's no one way to show up with a human being, which is at the very heart of Dr. Rampe and I's work now too. So, and am fortunate enough to have the training in compassionate bereavement care and also the neurosequential model, which combine both parts of my heart. And so in 2014, my dad was diagnosed with dementia, and I was actively in clinical practice. In 2017, I found, by way of a friend, who said, Bree, you have to read this book. And it was Bearing the Unbearable by Dr. Joanne Cacciatore. And I went, oh, God, because my dad was still living at that point, but his dementia was very fast progressing. And so by the end of 2018, I went out to participate in the compassionate bereavement care training with Dr. Joe, met her, and at that time she had just opened the first care farm in the United States. And I stepped onto that property and I went, with my entire being, like, this is what I'm supposed to do. And so I started working with her to mentor and guide me through, because I told her, I was like, I'm opening the second care farm in the United States. Like, that's happening. So for every day from 2018 until just over 2 years ago, my husband heard nothing about when we have the farm, and now we have the farm. And so the pivot there for me was upending my entire life, not just for my own professional self, but for my personal self, because I was like, not only do I need to open the second care farm, but to survive my own grief, because extended caregiving is traumatic inherently. And so to survive my own grief, I have to be in the trees and in the mountains to be able to hike and move my body and to be really still with the energy that's happening. And so in 2019, we moved, and in 2021, we bought the property that is now home to the second care farm in the United States, which is Magnolia Harbor Care Farm. So I love showing up with traumatic grief because I showed up in my own grief. I know how sacred that space is for clients, and that is very much why we're here. So we'll talk a little bit more about that as we're moving along.
Yeah. So feel free
Thank
to
you.
pop questions in the chat as we're kind of going through. We have a little bit of education and information, of course, but we will certainly have time at the end to make sure to more than just at the end throughout to make sure to answer some questions. So we will start with a land and labor acknowledgement. And we did it for Birmingham because UAB, of course, is the one hosting the event. So UAB is located in the traditional lands of the Muskogee Creek and Shawnee people. We honor and respect the diverse Indigenous peoples connected to this territory that we now occupy. This land acknowledgement is to really pay respect and honor the elders of Indigenous people and nations, both past and present. We encourage to take a moment to really consider the many legacies of violence, displacement, migration, and settlement that bring us together today. Very appropriate for the topic, right, that we're talking about intergenerationally, the amount of grief that many different groups of people have went through. And so the labor part is that acknowledging that much of what we know of this country today, including culture, economic growth, development throughout history and across time, has been made possible by the labor of enslaved people of color and their ascendants, and we're indebted to their labor and their sacrifice, and must acknowledge that tremor of violence throughout the generations and the resulting impact that we can still feel, so certainly systemically today too. And then Dr. Bree,
Yeah, so because of the very nature of the content of this, as we move through the material, you are going to notice that emotions may come up because naturally, as we are hearing material, we think about and reflect how that connects to our own lived experience, both as fellow humans and as professionals. So just pay attention if you start to notice that you're having feelings that were kind of unexpected, if you start to daydream, or if you feel your attention just start to wander. Just get curious about that, write it down. Know that it is absolutely okay to step out and pause if your feelings are too intense, because I know we share stories, and so sometimes those stories can connect right to that portal of your heart, and so always take care of yourself in the space of this work, and in the space of this conversation. If there are any pictures of animals, they are the animals of our care farm, Magnolia Harbor Care Farm. This is the prince goat of my heart. We now have 15 goats. We're not supposed to have favorites, so don't tell anybody else, but this is Cedar. He's very snuggly and cuddly and huggy. And so, and at the very heart of why we have a shirt that says, "Have you hugged a goat today?" with his face with heart glasses. And so just thinking about, what do you need to give yourself permission to do, feel, or not do to show up for this presentation? So just take a couple of seconds and reflect on, what do you need to do? How do you need to take care of yourself? What do you need to give yourself permission to feel? Or what do you need to give yourself permission not to do to be able to show up? Multitasking is not going to help your feeling space, I can promise that. So think about what you might need to shut down to be present. Okay, so grief, and I am doing air quotes for those of you that can see me, normal grief, so to speak, are those cognitive and emotional reactions that follow the death of a loved one. There will typically be connected to that strong feelings of yearning, longing, and sadness, along with some anxiety, bitterness, anger, remorse, guilt, and or shame. The feelings that pop up around that vary in duration and intensity, and they might fade and reappear. I often talk about these feelings ebbing and flowing, like waves that are crashing in, both in the quickness with which they come in and also the intensity. So the neurobiology of grief, for those of you, you may be familiar with this book. By the time we finish this conversation, we will probably have added to your book list by a few. And so Mary Frances O'Connor wrote this really lovely book called The Grieving Brain that tries to start to capture the neurobiology of grief and gives this beautiful illustration of a dining room table, which I'll share in just a moment, because we have these place cells that help us keep track of where we are in the world, but also where other important things are in the world, like a consistent source of food. So if you get up in the middle of the night and all of the lights are off in your home, you can navigate your house pretty well without stubbing a toe, falling over, tripping over, unless you're like me and you have 4 dogs and they might get up and not be in the mental map that you have of your house. But we have a mental map of our home, which means we know generally where things are. And so if we got up and we're navigating our home and somebody had stolen your dining room table in the middle of the night, you would actually be stunned when you went to go navigate around it and it's no longer there, because the place cells that are there that are holding it in that mental map it's not familiar with that. So the key problem in grief is that there's a mismatch between the virtual map we always use to find our loved ones and the reality after they die, that they can no longer be found in the dimensions of space and time. So that is when we talk about grief being so deeply painful, there's literal changes in our neurobiology that is happening because of the way that our neurobiology functions to hold the way we move and function in the world.
Yeah, one of the things she says as an example of what Dr. Bree just said was about how when people wake up, that initial moment when they wake up and they still have this thought, this presence that somebody's still alive physically, right? And how that's the brain not catching up. The brain doesn't know its map is still in existence, that this person is existing and in your life, and it might never catch up because this person could have been in your life for 50 years, right? And so the brain may not catch up and really knowing that that person is no longer physically here. So there may still be that residual moment when we wake up thinking this person is still alive, and that's something that people report a lot too.
Yeah, thank you for that addition there.
So when we talk about traumatic grief, Dr. Bree just went into, I guess, we say normal grief with it, but it adds a trauma component, right? Like there could be some cultural interpretation over what would be traumatic and what not. It's all subjective. Context matters a lot for the individual as well. But overall, the way it's defined is sudden or unexpected, violent, disfiguring, death after prolonged suffering, untimely death, multiple cumulative deaths. So somebody who had 2 siblings die in the last 6 months or the last year, right? Like those multiple cumulative deaths, death with threatened death, right? So that person was threatened before. And so that kind of adding to that violent piece. And then of a child at any age from any cause, for any parent, caregiver, extended family who was involved in that child's life, that no matter what, death of a child is considered traumatic grief under this.
Yeah, and I would add to that that, one of the examples that I always give around untimely death, because that can be a little bit confusing, around like, what do you mean by an untimely death? One of my very dear friends, who is in her early 40s, her dad died after being hit in a car accident after a drunk driver hit and killed him. And though her dad was in his 60s, and it is expected that in a normal life cycle, that your parent will die before you, because of the nature of his death, it was violent and disfiguring. It was sudden and unexpected. And it was untimely because, from the family's perspective, he had not lived out his full life cycle. So that would be an example of an untimely death. Even though he was, farther along in his life cycle, it was not complete from the perspective of the family.
There's been a good bit of research. Bereaved parents experience more despair when compared to other grieving groups, increased risk of psychiatric hospitalization and suicide, increased hazard ratio, kind of making those decisions. It's a rule that they made from this article, like don't make any important decisions within the first 2 years of having a significant loss. That comes from research and recommending that. Some self blame and shame, right? That may exist within how the death occurred. If the person wishes, I should have been there, maybe I was supposed to be there and I didn't make it on time. Maybe the ways, that maybe somebody made a mistake, which led to somebody's death after that. So if there is some connection with it, and even if there's not, there can still be a lot of self blame around this person wouldn't have been in this space, or I should have been in this space. There, it's such a awful, unbearable time that people often grasp at trying to make sense of it. But if you have that internal already, I'm not good enough, I don't feel worthy, it can come out in grief in very, very complicated ways that can cause even more complication when we're talking about the bereavement and grieving, integrating that loss into your life process. It's common that parents, especially, are prescribed psychiatric medication really quickly. 50%, this study found 50% were studied. 4 out of 10 were given, 50% of them were given overall, sorry, I'm totally butchering this. 4 in 10 grieving moms were prescribed psychiatric medication, 50% of them within 1 week. And we anticipate now those numbers are higher. And so that really, like that distress intolerance that we can see in culture at times, you're really upset, you lost a child, here's some medication to help take the edge off. The problem is that doesn't help people feel and actually process. And so there is this quick attempt at times, though, to make somebody feel better. And that can be really difficult if they're interrupting kind of that natural human grief process, right? If you love something, this is the one shared experience all humans will have, is you will eventually have loss and grief. And so it's an interesting cultural experience that we have such a hard time with that culturally, or within the United States, especially when it is something that we all will go through. And so the death of a child also can lead to a lot of anxious and depressive symptoms. But of course, those are false positives on a lot of measures that are used because they're more connected with the grief and the loss of that child, not that somebody is depressed or anxious in the way that we may look at it in medical communities.
Yeah, and I think it's important to note that it's not just our grieving parents where medication is very quickly prescribed. I work with a client who is in her mid 60s, and both of her parents were in their late 80s. And so, again, we expect that they are going to die before her. And when you live into your 80s, you're really grateful that you're there typically, but her parents both died within 6 weeks of one another, both of which were unexpected and completely, like they were just completely unexpected. And so the cumulative toll of that, and she was already on some medication for some underlying anxiety and depression, but her prescribing provider increased the medication because she was crying so uncontrollably. And then a year later, she started working to decrease those medications, and she was like, Bree, I don't know what to do. I feel like all I'm doing is crying. And I'm like, because for the past year, that medication has helped numb the edge of the intensity. And now all of those feelings that were under the surface there are going to start coming back in greater frequency. So we had to work really hard on her distress tolerance and being able to tolerate what was coming up for her that had been quite numb. So
some effects, and this Bree's going to go into more effects too. Of course, there could be some relational marital distress and difficulty. for parents, when we were talking about parents and caregivers who lose a child, the numbers are high, but they're of divorce and dissolution of that relationship, but not because most people think it's because of the loss. We know that it's actually because if it's a couple, they don't grieve together, even in getting their needs met. Grieving can look very different for all of us. And when two people are grieving separately, they're not interpersonally supporting each other, then that means they're not grieving together, right? And giving each other that support as well. So it's more about that connection in the grief that keeps a marriage together. Because a lot of people get very scared about that number. The numbers are high, but it's if we unpack it, it's more complicated than just saying that. So, of course, some communication, some intimacy issues, some impact of friends and family. One of the David Kessler wrote a book called The Sixth Stage of Grief, Finding Meaning. And it's finding meaning in the person's life more so than their death. I think the title makes it off-putting
Mhm.
because there might not be any meaning in that death, but it's my meaning connection with them in the fact that they were alive, right? And he talks about how a lot of people will be surprised later when their friends and family members maybe can't support them, cannot have a conversation with them about the animal or the person who passed, and really cannot hold space for them. And one of the questions he always asks is, well, how did you feel around them before? And commonly they'll reflect and say, well, I guess they could never handle this. And so it really can put a spotlight on people who in our life maybe we were able to overlook that they couldn't really tolerate certain distress, but now you can't, right? And now it's so needed to have somebody to talk to about this loss, that it's the social impact and changing of friendships is pretty significant. So some attachment concerns around continuing new relationships, old relationships, continuing to take care of children if you have other children. Intergenerationally, we know the impact. There's so much impact of losing a child and then having to care for the other children, and how that can go into the next generation in various ways, because the person or the people were grieving, and how impactful that would be on the children in that household too. Risk of substance use, social isolation, conflict within the family, suicidal gestures potentially. I don't want to be here anymore without this being, disrupted sleep and concentration. Just so many, and Bree's going to talk about more too briefly, but just so many that we could not even go over all the possible effects.
Yeah, and I also, though we're going to cover quite a lot of some of the effects that we see, and we're going to break it down into the different categories of being, so to speak. In the assessment world, for those of you that conduct clinical assessments, it's that biopsychosocial, the biological, psychological, and social aspects. But we also look at the physiological here too. But even though we're going to cover a lot of them, we can't cover all of them. There's still nuance to what your client will experience and what each individual experiences. So some of the physiological effects is that there will be sometimes rapid heart rate, shallow breathing, global pain. That same client that lost both of her parents within 6 weeks of one another, all of a sudden started having some really globalized pain that was very reflective of her grief, and it took quite a bit to have her providers help work with that too. Inflammatory diseases, there's a lot of science and research around what happens in the body when there's such distress and trauma to the system, that those inflammatory markers go up. And when that is sustained for a long period of time, we will see some of those autoimmune disorders start to pop up because the system has just been inflamed for such a long time. Hyperarousal, being very hypervigilant, gastrointestinal problems, headaches, and sensory malfunctions. I've had some clients that all of a sudden couldn't smell, or were so hypersensitive to certain sensory related processes that it was unbearable. I know for myself, when my dad first died, I run a lot. I love it. I know not everybody does, but I love running to music specifically. And so in the first probably 4 to 6 months after he died, I could not listen to music. I wanted to rip I had to rip the headphones out of my ears, because it was just too much for my system, because my system was so loud already from the intensity of the grief, because there'd also been such prolonged caregiving. From the time of his diagnosis to the time of his death was 5 years. And I was 30 when we started that adventure. So there was just a lot. And so be really attuned to and attentive of anything physiological that can pop up in response to that. Beautiful quote: sorrow which finds no vent in tears may soon make other organs weep. The sorrow needs to come out and it needs to be expressed. Some of the emotional artifacts of that is you'll hear folks describe having this numbness and kind of emotional anesthesia, like nothing really, things that should land in some kind of emotional space or have some kind of like queuing up of, I need to respond to this in some way, lands in a very numb and just numb, flat space. Being apathetic, having some rigidity around certain things, because when everything feels out of control internally, you want to be really rigid around certain things. Fear and anxiety, depression and despair, having some anger and rage, having a decreased connection and sense of belonging. We're going to go into that just a little bit more. And being really frenetic because there's so much energy in the body and that's being held in there, that there's just that really frenetic energy that you might see for someone.
That grief brings up a lot of challenges that somebody may have already faced around that emotional expression and emotional release, and how important that is to talk about. Well, how did you manage emotions before this? And so many of my patients will say, well, I didn't, based on maybe their childhood early life trauma or neglect, and not getting that skill, that social and emotional skills to really know, how do I sit with emotions, how do I have that compassion and soothing for myself to release it and allow it. And so it can bring up a lot of other things that were there too.
And some new things can pop up too. For myself, I love flying. I love traveling. And in, I think it was 2016, my husband and I were going to Ireland for our anniversary. And like, you could not have convinced me otherwise the plane was going to crash. Like, I was asking him who was going to take care of our dogs. How did we need to make sure that the people that we wanted to take care of them knew that? And he's like, Bree, like, do you know how many planes fly every day and don't crash? And I was like, it was such anxiety that anytime there was turbulence, I mean, his poor arm, I like, praise the baby angels, he has really nice muscular arms, but his arm was so, like, I mean, he had my finger marks on his arm from where I was squeezing his arms from just the fear and anxiety. And that was totally new for me. And when I really sat with it, I was like, oh, right. My dad is one of my safest humans. And now this human that I know is my safe base. I was walking through losing the connection into his safety, and it didn't feel as safe to go explore the world and go out and travel. And so help be attuned to when new things pop up. So to Dr. Ramp's point, if it might exacerbate something that was already there and had already been worked through or resolved, and it might develop new things too. Interpersonal effects are some of the biggest effects that we see in grief generally, but especially in traumatic grief. So Dr. Ramp talked a little bit about the marital and relational distress. You have two individuals that have experienced the loss of the same person, but are experiencing it very, very differently. And there might be different points where they are feeling really stuck in the grief story, or just the moments, the narrative that they're holding around it, which creates a lot of distress. Because for one person, there might be a lot of expression about emotion, and for the other, they might be really shut down around their emotions, but are very highly functioning and working really hard. And so the person that's expressing a lot of emotion might be like, they're not even grieving. Like, do they even have feelings at all? And it's like, oh, they do. But it's my personal way to deal with grief, which is to overwork. Because if you're overworking, you don't have to feel the feelings, right? You create a numbness and a busyness that allows you to avoid it. Social isolation. So it takes a lot of energy to engage socially. And so some folks might start to withdraw from those social relationships. And then depending on the nature of the death of their loved one, people may not know how to show up. And so instead of just showing up in some way, they just don't show up at all. Or will say something to the effect of, well, I didn't want to make them more sad. And it's like, they're already sad. You don't have to worry about that part. They want you to remember their loved one with them. So please ask about their loved one. Creates a lot of difficulty with communication because what they are experiencing, especially when it's in the land of traumatic grief, it's beyond words. And so that expression of grief, there might be an expression that it comes out very angry or anxious or fear-based, or there might be complete abolition of words. Like, it just might be void, so to speak. Intimacy issues. intimacy issues happen. I've had some clients say, like, I can't even think about being intimate when my child has died. Like, there's no way I can think about doing that. It creates a lot of struggles there. Attachment concerns, it can a traumatic loss can impact those attachment based frameworks. So I shared a little bit about my dad. It created some anxiety for me that had not been present before, because that attachment was being rocked and severed, really. Family relationships. Had you asked me prior to the experience of walking the end of my dad's life, if me and my family were close knit, I would have said absolutely. Like, they would hands down show up. But then, when my dad was actually placed into an assisted living facility, it was just me and my husband, which is a lot because we were in our early 30s. And when family members would say, "Bree, just tell me what I can do," I was like, I actually don't need anything. What I need is for you to help put eyes on my dad, because Lyle and I are working, and I really need help putting eyes on him, because in the first facility that he was in, he was physically abused, and so I just wanted eyes on him. And a couple of my folks lived very close to the facility, and in the almost 3 years that he was in a facility, didn't show up one time. Now, on this side of it, I can see that it was a reflection of their own grief, but in it, I was real lonely. Social relationships, that the impact of grief really impacts the ability to show up in social relationships as you always have. I know, I use myself as an example because I've lived it, and so my disposition is very joyful, and I typically am a glue in social relationships, and so when I didn't have the energy to reach out in the same way that I normally would, I had a lot of friendships that were really impacted by that, that end up falling to the wayside, and there was grief. There's secondary grief around that because they're humans I love so dearly, and that to this day I still miss, but we haven't been able to reconnect because the truth is that those grief, sad parts of me still show up, and I own those more authentically and wholeheartedly now. But social relationships are really impacted in that. Colleague relationships. There's a client that I work with whose wife and 2-year-old child were killed. And when he went back to work after their funeral, he works at a university. And his entire department was instructed by their department head to not say anything to him about it. That if their names came up, to just not to change the conversation. And he was like, "Bree, the most hurtful thing that could have possibly happened was for nobody to remember them with me." So what we know to be true is that social support safeguards against negative psychological and physiological responses of stress. It literally creates a buffer of protection. There's lots of fancy research that says so, like very fancy people that have done lots of really good research around that. The quantity and quality of social support is important for grievers. It can't fall on one person, but you can have 100 people that are in that person's social bubble and they don't show up well. That's less impactful and supportive of that person than a handful of folks that show up beautifully. The problem with social support, though, is that Dr. Ramp, do you mind going to the next slide?
Oh.
Or did you have anything to add before we? Yeah, go ahead. I'm sorry.
One thing real quick of what Dr. Bree's saying, that is such a common thing from parents, especially, but for anybody, that idea of like, I don't want my child to be forgotten about, or I don't want this person to be like that. If you don't acknowledge or ask or remember birthdays or anniversaries, or just ask about them, ask about how they're doing, how are they continuing that bond? And some people would be like, why would I ask how they're doing? Of course they're doing terrible. Well, now you're a person who they can say, I'm doing terrible.
Mm-hmm.
And just that you've opened that door, like, you can tell me if you're doing, I want you to be honest about how you're doing. And I'll share a brief story. But I had a past past coworker at the last university I was at. Her dad died when she was a teenager. And then my dad died from an overdose, of course, when I was 35. And we were in the middle of a presentation and I'm doing a training, and she brought up, I brought up something about how, you have complicated relationships lead to complicated grief. And she made a comment, well, I actually loved my dad. And it was insinuating, though, that I didn't. And so it really led me, I mean, I was pissed, but I had to do the rest of this training. So I had to put that on the shelf and come back to it later. But it really can be eye-opening around, I had no idea she had that much judgment towards people who struggled with addiction, and not understanding that there's many different avenues, many different reasons that people will end up being addicted to whatever, whatever they may be addicted to, which a lot of people are addicted to something. But that the way somebody can pass can also bring up, wow, I didn't know this person was this way, right? Like this person was that harsh about this or that judgmental about this. So it can be eye opening in a pretty awful way.
So Dr. Joanne Cacciatore did a really lovely research study on what is good grief support. And if you look at this, you can see that satisfaction with overall report, they had, I think, something like 300 people respond to this. And 78% were extremely satisfied with their pets and animals. And she just threw that question in at the last minute to see, like, well, let's just see if anybody says anything about these animals. And then the next highest category after that was online grief groups, and the satisfaction, like the extreme satisfaction of being satisfied with that particular modality of support, was 39%. And so we have a lot to learn from our animal friends around how to show up for fellow humans that are in these grief spaces. And I wish that I could say that counselors and therapists were higher than they are, but unfortunately, because if you're human, you are going to experience grief, which means that when somebody else is talking about their grief, it's going to put you right squarely in the middle of your own feelings and your own story. And so you have to, and that's part of the framework that Dr. Rampe and I use in terms of showing up, is how do you show up for yourself to show up for others, and holding the duality of that. So.
Yeah, and so this and thinking about friends and family and the people who we support in our lives too, those numbers are really low for that
Mhm.
extremely satisfied, right? Like, and I know, of course, we could just say, okay, well, I guess I go get them a dog, and then have them with that. But it would be nice if they had all of it, right? Like all of the support that we could possibly give them and acknowledgement. And really asking, somebody wrote in the chat, people have a hard time knowing how to show up, which we're going to get to, but it's it's so it's not that difficult at times just to ask what somebody needs. How can I support you? Can I just be with you? Can I sit with you? Can we do something together? Or can we just be together, right? I think we overcomplicate it because it's such a sad, distressing situation that some people overcomplicate the basics of just human to human contact.
Yeah, and so in the same study, participants discussed a lot about how important it is for other people to just listen, to learn about grief, to show up and not avoid them, and to accept their emotional state just where they are, not to say, well, don't be so sad. At least, the silver lining of where somebody is, and made statements such as, if they would just allow me to express and honor what I feel, or not trying to fix what can't be fixed, by accepting the new sad, grieving me as someone who is okay to be with, and not expecting me to feel like I need to get over this or move on and become the happy person I was, not making me feel like I have to wear a mask and pretend I am someone I am not. Animals are not usually included in our conceptualization of possible sources of social support and bereavement, but they really are exceptional at holding the unconditional and non judgmental space craved so deeply by so many human beings.
So this is a quote I just love from the training, but it's from a book called Healing the Soul in the Age of the Brain. It's typically American to equate healing with doing something. When we have a problem, we fix it. We prefer to do it quickly, but fixing is not the same as healing. In fact, it can easily get in the way of healing. Fixing is something mechanical, scientific, economic, military. Healing is something human, emotional, spiritual. And the author of this book is a psychiatrist and a psychotherapist and a patient and a human, of course. I've learned that before you can fix a problem, you first have to feel the problem. Healing happens not through doing, but through feeling. And I always think that's such a powerful reminder around how we have to be with the emotions around this being that passed, and that it would be, again, how we can support others in being with the emotions and holding space for that too, before we expect them to go do things, before we say things like, let's go drink and let's go have a glass of wine and let's go do that. Like just being with it. We don't have to do anything to try to make it go away. We have to be with it first too. And so this is, and Dr. Bree, feel free to jump in on this. This is the, hoping y'all can see all this, try to move this around. this is the model that both of us use, that the compassionate bereavement care certification uses. It's called the ATTEND model, mindfulness-based bereavement care. And so the ATTEND is an acronym that stands for being very attuned as a clinician. And this is just humans. So of course we use it as clinicians, but any human, that attunement to that person, attunement to ourself, attunement to the emotions needed in that space, very much a powerful presence of giving them your full attention and attunement, presence of being there, really that trusting relationship that we hope, like Dr. Bree said, all those great things about the interpersonal effects, the great effects of interpersonal support, having that trust within that relationship where people can tell us. One of the things that's really important, and it goes with this humility, the way that we continue the bond, the way that we integrate loss into our life is very unique. It's very subjective. And so that looks really different. I don't know what that looks like for each person. We explore what they're comfortable with, what feels good in terms of doing that. It's shared in decision making of what this will look like. It's not me telling you, you need to go do this. You need to be over it. You have 6 months or whatever, right? Like very humble. And that relationship was unique between the, person and animal, or person and person. The uniqueness will continue of how that continuing the bond and integrating that loss into a person's life will look as well. It's very nuanced, again, in that humble way of how this is important, how this looks, how does this show up for people. And then education, of course, can always be really important. And Bree mentioned this, and I'm going through this a little fast because I want us to have time to get to everything. Bree mentioned that we emphasize a lot of self-compassion, self-care as the provider, but for you as a human, supporting another human too. It is hard to sit and hear some of the stories at time and some of the true lived experiences that led this person to have whatever, they're coming to us as clinicians for. And for you as a peer support, that can be hard too. And so that self-care piece is really, really important. We know that it provides more post-traumatic growth, more satisfaction within the person, better outcomes for individuals, families, and communities. So there's a lot of benefit towards using a more mindfulness-based, compassion-based approach model. Which goes perfectly into when we talk about grief and what we mean whenever we talk about integrating the loss into the life. And let me pause it. And Andy Grammer's a singer, and he shares really briefly a clip on a podcast around his experience with losing his mother. And it's a beautiful, beautiful way that he talks about it. But this uniqueness, it's very unique for him. And we want to just that reminder of it's unique for all of us.
I like to go on offense sometimes with grieving. If I see someone that's the same age as my mother in front of me in line, I'll go on offense and I'll be like, hey, I lost my mom and I don't get to buy her stuff. Mm-hmm. Would you mind if I bought your coffee, right? I'll just live that way. And when you live that way, crazy stuff happens. Yeah. And you're just kind of in the flow and putting your tokens in, and the downside of it is sometimes you look stupid. Sometimes you're like, it's really weird, man. No. But when you're playing with this openness, I had a show in Boston. I went to go get breakfast near the place, and 4 ladies walked in that were about the age of my mother. It's always a little bit delicate because I don't know, something about when you're right next to the venue that you're playing, I didn't want to come off like a big shot, but I had this feeling that was, you should go pay for their breakfast. I'm sitting at the table, I'm like, you know what? Usually I would just do that, but just being next to, I don't know, it feels like I'm trying to brag or something.
Yeah, sure.
So I let it go, and then it comes up again pretty strong in me that yo, you need to go do that. Finally, I just go give into it, and I walk over and I say, listen, my mom passed away. One of the things I like to do for her is just pay for women's breakfast. Sometimes it would mean a lot to me around her age if you would let me take care of your breakfast this morning. The lady on the left just starts bawling. And she says, I lost my son. He's about your age.
Oh, my God.
And so we stand up. I'm just bawling with a stranger.
Oh, my gosh.
I dare everyone to live and play with it. Grief doesn't have to be something that just hits you when you're not ready for it. I tell everybody that's going through the loss of someone, what do they love? Do they love bread? Their thing was to make bread. Set days and make bread and give it out. Go on offense to be a part of it and get this really sweet feeling of remembering them.
We love that clip, and really thinking about, that's what we mean by that integrating, right? That going on offense, remembering them intentionally doing something to feel close to them, like you talked about bread or breakfast, whatever that may be, but definitely something that we, when we're talking about that grief work, it was just a beautiful little clip about it too. So Dr. Joe does a whole YouTube series called Bits and Pieces. It's fabulous, Dr. Joe and Kashtori. And we highly recommend. It's a whole series, and they're all 2 minutes or less.
It's so good.
Yeah, one of the things that she talks about is you don't always have to wear that backpack, right? Like there are times, we're not saying that you carry it and you're constantly in it. Of course you are, at times, but that you can come back to it. I felt this, I really allowed myself this emotional expression and release and acknowledgement of this being and what came up for me. And then I'm going to put it down and come back to it. We're not saying your whole life has to now be about this. It's more of, in the beginning, especially if we don't allow ourselves to really feel, to do that active healing, this idea of even picking up and putting down a backpack, of course, is a lot harder. I love that permission of when somebody maybe says a platitude, they're in a better place or whatever it may be as a platitude, that giving permission of just saying that's not my truth or that's not how I experience it. To really tell people that, and especially if it's somebody who you see a lot, because if they say it once, they're probably going to say it again. And so considering how do you express that to let them know this isn't something that works for me, really being intentional about that, continuing the bond like Ada Grammer was talking about. Could be big, it could be small ways. It doesn't have to be these huge anniversary events or these huge birthdays events. One client that Dr. Joe talked about working with, this child had died and he was on his bike and he was holding a Pop-Tart when he was hit by a car and passed. And so that family has Pop-Tarts, and that's just something that they do pretty regularly. And that's something where they intentionally connect with him and each other. But I mean, of course, would Pop-Tarts work for anybody else? Maybe not. This is that uniqueness, that nuances of it. And that's something small, technically. It's eating a Pop-Tart. And so that thinking, it doesn't have to be just these huge things. And we talked about that kind of like meaning more in their life. Some people find meaning in loss. Some people find now Dr. Joe's work. She had her daughter Cheyenne was stillborn, right? And they had no reason for it. And that led her down this work. But her, like many other people who end up, doing this great work after a significant loss, would all say adamantly that they would give it all back if they could have that person back. And so that's not everybody's experience. You might not open up a huge organization after you've had a loss, right? And that's okay. It doesn't have to be what you do. Some people do, some people don't. And there's really no timeline. So that kind of reminder with that too. Bree, did you want to do this one?
Yeah, and so, can you hear me okay? Okay, there we go. In that same article that was what is good grief support, written by Dr. Joe, identified that there are these 4 categories of supportive actions in grief, because there were different ways and different facets that people can show up. So there's some of the acts of emotional caring, which is remembering the person that died, saying their name, sharing memories, acknowledging important dates and holidays, emotionally sensitive communication. And then there's actual emotional support, showing up, being present, allowing for the expression of grief, listening, being available, devoting time to that person, being open to their grief emotions, not trying to fix or rush grief. You don't have to. The thing is that we actually don't have to say anything. People just want to be heard. They want their grief to be witnessed, because so often we think that we have to have something that's so beautiful and eloquent to say, when in reality, people just need to be heard and held. And people know that they are being held when you are fully attuned and present with them. They know, and you don't have to say anything in that. It's really quite beautiful when you can just hold that attuned space that doesn't require words. And refraining from unsolicited advice. If somebody wants your advice, they'll actually ask you for it, but be really, really reserved in giving out that advice, especially if they have not asked for it. And support that's timeless. Don't put a timestamp on it, essentially. Instrumental support are things like assisting with childcare, assisting with meals. Some folks will set up a meal train. Financial support, because sometimes there has been significant impact to a family system, especially when there's traumatic grief that is present there. Doing yard work, and housekeeping, writing little notes and sending little gifts to just let the person know that you're thinking about them. And appraisal support, which is the sense of connection with like others. So connecting with fellow bereaved humans. attending support groups and extended communities like faith schools and neighborhoods as they are safe. I often refer to this as finding your safe grief people. You need to find those people that can really hold your grief, and some people, there's just different ways to offer that support in the spaces of grief.
And I'll add with the meal support, it's really important to ask these people, as some people just have had a huge hit to their vagal nerve, right? Like broken heart syndrome is real for not just couples, it's for anybody with significant loss. The vagal nerve implications and negative impact are significant. And so asking somebody, what they actually will eat is important instead of what you just want and like to cook. And so just that, like, what's actually helpful for them.
I'll keep this really brief because I'm so mindful of where we are with our time, and we want to hear from you guys and open it up. You can learn a little bit more about the Green Care for Trauma and Grief. It is at the very heart and the framework of what we do at Magnolia Harbor and under the compassionate bereavement care lens, so to speak. So there's 3 primary facets, which is the care farming. So Magnolia Harbor is now home to, we're just going to average it to 45 animals. All of them, with the exception of some baby goats that were born at our farm, are rescues, and we honor the bonds of animals, and so they got to stay here, the baby animals did. But rescue animal care, actually tending to the animals, agricultural activities, there is something about some sweat equity, y'all, where you just sweat it out and move your body. Being engaged with nature, being engaged with animals. Again, animals are such beautiful holders of space. Getting into the earth with therapeutic horticulture and gardening, and just being outdoors and participating in that green space and ecotherapy. Contemplative practices, which really captures meditation, getting grounded, quite literally grounded, bibliotherapy, connecting with books. I think Brian made a comment about there's nothing like a good book, or it's something about really good books. Absolutely, you see yourself through the words of others and find some books that are really helpful. Can't recommend Bearing the Unbearable enough. Rituals. Rituals are so important in grief, and yoga, and then tending to the physical body, the physical well-being, exercise. A lot of times, more often than not, sleep is impacted in the spaces of traumatic grief, and so working with somebody to get to sleeping better is one of the first things that I do, because if they're sleeping better, they feel better overall. Improving their stress resilience, and just psychoeducation generally about what it is that's even going on.
We will stop here so we can answer some questions.
Yeah, I know. Where is art in this formula? Is it okay if I speak to that question really quick?
Oh, yeah.
So at the retreats that I hold at Magnolia Harbor Care Farm, there is a lot of expressive art-based intervention that is tended to in there. I don't think it said it specifically in that framework of the green care piece, but yeah, Becca, do you want to share a little bit more too?
The Salah Care Farm also includes it in a very pivotal way around that creative expression. Traditional talk therapy, right, is talk focus, which is very much accessing our cortex. And when we're in such a dysregulated place due to loss, it's harder to access. And so that's where art can be a beautiful thing of expressing it through that. And then when they're in a space where they can, share it and want to talk about it, they can. But definitely emphasizing that we always don't have words to go along with it. There's other forms of expression that can meet, your limbic system in the way that it wants to express those emotions. It doesn't require journaling and talking, which can be really hard with the nature of the loss for somebody too.
Yeah.
So it's important and, again, unique, right? Like, some people don't like to paint. Some people love it, for the person.
Yeah, we create things that are nature-based, but movement in nature is like the movement of the body, so to speak. So Melissa wrote a question a little further up. I have a client whose son died by suicide 5 years ago. She was the caregiver for her stepmother and father, who both died last year. She now has 3 full-size skeletons in her home. She is named after them, and she talks with them daily. Any comments? And like the first couple of things that come to mind for me, number one is like what's coming up for you around that. Like what is your reaction to that, and being really connected to that, and just noticing, like, is it your feelings, is it their feelings, like what's coming up, and if you're concerned about that, like let's talk about it. But then the next piece is it's that externalization of the relationship. And so I'm curious, I just want to be really careful and attentive to what is that doing for her? How is that continuing the bond with those humans? Dr. Ramp, there's so much that I could say, but I'm acutely aware that we only have 2 minutes. So Melissa, I'm happy to discuss this offline with you too.
Yes, we are happy to discuss it more, Melissa. Yeah, I would say the same. Dr. Bree said this is where it's very nuanced, very unique. If it's something it is about the continuing that bond and continuing, I have a lot of patients who will post pictures and they talk to the pictures in the same way. And so, if it's something that's helping, and that is sustainable and in a healthy way for this person, then that's a different conversation around that. But this is where it can be really unique about what works for each person.
Mhm.
I feel like we missed one.
I feel like there's so many questions. Does anybody want to come off mute? And oh wait, there it is. I have a patient who I just heard somebody, but I don't know who you are. Go
Sorry,
ahead.
it was Kimberly. I was just going to read that question. Go ahead. Thank you.
I have a patient who I've been doing IPT with for grief related to losing a full-term pregnancy. It was 40 years ago, and she did not get to see or hold the baby. That just makes my insides just crumble for her. Whenever I try to encourage any movement in the grief cycle, saying goodbye, reminiscing, she says, how can I say goodbye if I never got to say hello? Unfortunately, her surviving children are not doing well due to making poor choices in their lives. Any suggestions? The first thing that comes to mind for me is not forcing her to say goodbye, but honoring that she really wants to say hello. I would want to be where she is in that. And how can she maintain that connection with her child? Like, what does she need to feel like she is holding her child?
I feel like she can say hello. That important.
Yeah, that's right. Saying hello. Mm-hmm.
And hello can be a part of my life. And this is where things have changed a lot with the way hospitals handle stillbirth. So I will say that too, or handle any kind of pregnancy loss, and so that it's changed a lot having that, letting the parents take pictures so they get a different experience, but definitely devastating that this is not always a practice even now. And so that, how do I say hello and really be able to continue that bond, and how that will be unique, of course, for that patient. Yeah.
Mm-hmm. Mm-hmm. Yeah, and same thing there, Laura. I mean, I know I can speak for myself, and I'm sure that Dr. Ramp is too. I'm happy to talk more with you about that one offline too.
I know our time, Kimberly.
Yeah, I know. We knew this would happen too.
Yeah. Well, and like I said, we'll have to bring you back. But I just wanted to, the next one that came up was about loss of a birth parent via adoption and how to address unacknowledged traumatic loss. Any thoughts there?
My initial reaction, and I think I said that to Sarah, is that I am working actually to develop a retreat very specifically for that, because I hear that so often, and I work a lot with humans that have been adopted, whether they are still minor children or adults, because there is so much grief in that that's ambiguous. It's ambiguous because perhaps there hasn't been the death of someone, or maybe there has been, but I would love to talk more about that.
Yes, and I just want to acknowledge other people who have shared some of their personal stories and experiences in the chat. So I'm so sorry we're out of time, but I would like to thank, of course, Dr. Ramp and Dr. Bree so much for sharing their incredible wisdom and experience and knowledge with us. This is obviously a very important topic that it affects or will affect all of us at some point. And I want to thank everybody for joining us today. Our next Virtual Mental Health Monday will be November 13th. We're going to talk about the healing benefits of singing. So whether it's from a physical perspective or the importance of community singing. And then for those of you in Birmingham, Renee Fleming is going to be performing on November 5th at the Alice Stevens Center, but also she's going to be leading a panel discussion on November 6th that is free to the public. It's going to be moderated by our university president, Dr. Ray Watts, but it's all about arts and health research and some of the local work that's happening as well. So if you can, join us. Otherwise, thank you so much for being here, and we appreciate you all. Thank you.